Awesome. Can you turn the captions on also?
How do I do that? Hold on. I don't know how to do that.
Hold on just a second.
I think it's when you put it in YouTube, I think you add the captions, isn't it? Or is it able to be on now? Anybody know?
Well, I don't know how to do that.
If captions are not on, guys, we will absolutely figure out a way to add captions on YouTube. So if you're like super smart with Zoom and you know how to do that, speak up. All right. So just a couple of things. Again, welcome. We have a couple of fantastic speakers tonight that we're going to be talking about or talking with, and they're going to answer some questions. I want to start with, this is not a call of judgment or condemnation. This is informative. This is information that we want to make sure everybody has in their back pocket to make informed decisions when choosing which type of weight loss journey they want to go on. This has become a really hot topic, so we felt it was enough for us to actually address tonight. And so we will have some Q&A, and the Q&A, if you don't mind, put it in the chat. And we will pick and choose as we go along. We may not get to everybody's, but we will certainly try to. So first of all, I want to welcome Carmen Broussard. Carmen is a dear friend of mine. I have known Carmen for probably 25 years or more. She received her associate's degree in 1997, her bachelor's in 2001, her master's in 2015. She has been a nurse practitioner for 8 years. She is a board certified family nurse practitioner. And Carmen is going to talk tonight about what she's seeing as a provider in her clinic, and what she is hearing from patients, and then kind of what their responses are back to the patients. So Carmen, if you want to go ahead and get started.
Welcome, everybody. Hi, I'm Carmen. So usually when I have a patient come into my clinic, one of the first things they say to me is like, hey, I need to lose weight. I saw this great thing on TV. Can I have that? It said, ask your doctor or your provider or whatever. And I die inside. You know, it's like, what else have you tried? Oh, nothing. My sister was on it, or my coworker was on it, or they've done great. Okay. So I simply just go over the potential side effects, which I took directly from one of the websites of one of these products. And once I go over those, their face just, what? Deer in the headlights. And I don't think they realize, hey, this could be very concerning for you. There's also been reports of stomach paralysis, basically gastroparesis, when the stomach just stops working. One of the ways this medication works is to delay the emptying of the stomach, which will slow it down. Can you imagine your stomach slowing down? Everything else will slow down. So guess what that leads to? Now you've compounded the problem. So yeah, not really comfortable. This can lead to nausea. This can lead to rapid weight loss, which is in itself not healthy. The other thing is when they say, hey, yeah, I'm game. I want to do it. I don't care. I'm like, okay, well, what is your plan for after you've lost, insert number here, amount of weight? What's your plan after that? Because once you go off the medication, if you haven't changed anything, it's going to come back. So what's your plan? Crickets. So
Carmen, when people come in, are they
does anybody else, Phyllis, do you have anything else to add to that?
Carmen, can you hear me?
I can.
Okay. So one of the questions that I have is when your patients do come in and they've seen the TV ad and they're excited about the weight loss and you explain the side effects to them. And let's say they had no idea, like what kind of assessment do you guys provide for them to see if it's safe for them to do it? And is that even something that providers are doing?
It is absolutely something providers are doing simply because they really don't, how can I say this? Most don't know any better. There is one product that is strictly for weight loss, but the name is changed slightly so that it can be marketed just for weight loss. The medication itself, the generic form, is exactly the same. So I say, okay, well, if they mention a particular product, which I won't say the names, but if they mention a particular product, can I get on, this? I'm like, okay, when were you diagnosed with diabetes? They're like, well, I'm not, I just want to lose weight. I'm like, it's only indicated for diabetes. And I'll show it to them. I've even gotten an email, I think it was an email or a letter, I can't remember which one. One of the drug companies of a particular product. And I think it's one of those canned letters, all primary care providers or providers. Please, please, please only prescribe per the FDA approved indication for this drug. So in a nutshell, translation, stop this weight loss thing.
And how do the patients respond to that?
Most are so desperate and don't know any better that they're like, I'll take the risk. I'm like, oh my gosh.
So now I'm going to move into kind of a different area, and you may or may not know about this, but I'm seeing recently some med spas are promoting these shots. It's a completely different animal. How are they doing that?
That is really unknown to me. I have had some patients going, well, I know of a med spa, wherever, and I'll just go there. I'm like, you know my thoughts about, my thoughts behind this.
Okay.
And whether you get it there or you get it from me, which you're not, the risks, the side effects, the potential complications down the line are going to be the same.
Right. And just kind of, I'm gonna look at the chat for just a second. Somebody just asked,
Spa does this. I don't know that I want to know.
Because most med spa, I know personally someone who owns a med spa, and it is actually, they have to have a physician. And so that physician is typically the one that backs it, basically. So it's I think it kind of maybe falls a lot of line, like with Botox, for instance. Med spas cannot promote Botox as a migraine relief adjunct, but a doctor can. So I think maybe the same. I don't know the answer to that question. Is there any way to increase the Zoom capacity? Jessica asked. It will not let her increase it. I am so
okay. And I see Thomas Hemingway, Dr. Hemingway's here too. If you need him to sign or chime in a little bit with some of this, he is here.
So okay, Carmen. So Carmen, if you do you have anything to wrap up with, Carmen?
I saw a news report. I don't remember again where I saw this. This is a couple of days ago. There is one drug company that is actually pursuing legal action against med spas.
Okay, she keeps freezing. I'm so sorry. So Carmen, thank you.
Against, because of these.
Yeah. Okay, Carmen, thank you so much. We're going to go ahead and because we want to keep this short for you guys. We do not want to keep you guys all night. We know your time is valuable. So I'm going to introduce Phyllis Anderson right now. Phyllis is going to talk just a little bit. She's going to introduce Dr. Thomas Hemingway, who is going to have a lot of interesting and probably shocking data if I know him. But Phyllis is going to go ahead and introduce him, and we're going to get started with Dr. Hemingway.
Awesome. Hi, guys. I'm Phyllis Anderson. And just really quickly, I am a registered nurse. I've been in the healthcare world for 28 years. ER was my home for 22 years. And I'll add some things at the very end, but I'm here to introduce Thomas right now. You guys, he's an amazing physician. He has a podcast. I don't know if you guys have listened to it, but definitely go find him because he's all things very holistic. He's covered so many topics. He's definitely cutting edge. He knows his research, but his podcast is called Unshakable Health Podcast. He has a book, so he's a published author. Preventable is what it's called. 5 powerful practices to avoid disease and build unshakable health. He is a board certified physician in emergency medicine, who's also trained in integrative and functional medicine with the Institute for Functional Medicine. So with that, I'm going to turn it over to Dr. Thomas Hemingway.
All right. Can everybody hear me? Give me a thumbs up because I couldn't hear you at the beginning of this, but cool. People can hear me. Amazing. Thank you, Phyllis, for that. So I'm Thomas Hemingway. I'm a physician. I'm a doctor, of course. I'm not your doctor. So nothing I'm saying here will be medical advice. There is zero medical advice. This is just helpful information. I hope you find it informative. Phyllis asked me to chat for about 10 minutes on Ozempic. Give me a thumbs up, Phyllis, if that's still allowed. Do I have 10 minutes or do I need to shorten it more than that? Because this is a giant topic. You guys know Peter Attia, cool dude, wrote a book called Outlived. Many people have heard of him. He talked for 2 hours plus on just this, on Ozempic, on his podcast a little while back. So it's definitely a big topic. I'm not going to keep you for 2 hours. I'll give you kind of the nitty gritty kind of quick facts on it. I'll give you a little bit of my experience. And if you want to know more, I've actually already recorded a full podcast on this topic. And I did it in the last couple of days because I heard from Phyllis that this was something folks wanted to know about. And so I did a bunch of digging, did some research, like Misty was saying. I love to dig into the research, and I don't like to just share what's my, quote unquote opinion. I like to share facts. I like to share the data. And so you can, get familiar with what is important, the so-called rubber meets the road kind of stuff. So if you're interested in learning more, don't hesitate. Check out the podcast. It's called Unshakable Health. By the time this ends at about 9 o'clock, or I guess it would be, maybe it'll be 10 o'clock Eastern when we're done here. The podcast should be live. I've timed it so that people aren't, jumping the gun here, but it'll be available for you in about an hour. So check that out. So Ozempic, what is it? Well, it belongs to a whole class of medication called the GLP-1 analogs. And there's 12 of them. There's a whole dozen of these medications. It's interesting that Ozempic gets all of the press, if you will. And probably the reason for that is there was a national shortage. Maybe you heard about that. And the reason for that was that originally this medication, this has been approved now for over 5 years, I think 6 years now, 2017, I believe it first came out for the treatment of type 2 diabetes. So that was the only FDA approved indication for this medication until recently, when the same company, Novo Nordisk, which was allowed to use that same medicine, semaglutide, exact same formula, everything's the same. Now they have an indication for weight loss. And so there are 2 different indications for the same medication. It's not any different. The only thing that's different about the newer, well, it's not even newer, but they call it newer, the Wegovy, which is actually still semaglutide. It's exactly the same medicine, Ozempic, same company, same everything, but they have this indication for weight management. And it's a very specific indication. So it's not just anybody who wants to lose weight can get this medication, or at least they're not supposed to, right? You're supposed to be actually qualifying as obese, which is body mass index greater than 30, or if your body mass index is less than that, you're supposed to have at least one significant comorbidity like cardiovascular disease, type 2 diabetes, hyperglycemia, hypertension, these kinds of things. So although, a lot of people may desire this medication, it's not supposed to be given out like candy, if you will. It's not supposed to be put in the water. It's not supposed to be used universally because there's supposed to be some set criteria. So I kind of heard about the med spa use of it and stuff. And if they're not following the indications, I agree, they could be getting in trouble for that. And so here's the standpoint. I want to just give you the facts here. I don't want to get philosophical. I mean, at heart, I'm a holistic guy and I try to avoid medication. There are some benefits to this medication. And when it was first designed and it came out 5 or 6 years ago, it was for type 2 diabetes, right? It was to improve insulin sensitivity. So what it does is it works at the level of the pancreas to increase the secretion of insulin. So more insulin gets into the system, you have less hyperglycemia. As a corollary to that, you have better controlled overall blood glucose, your A1C goes down. Also, it tends to increase the sensitivity so that the insulin works a little bit better. There's also a satiety effect. And so a lot of folks, one of the first things they notice when they're on this medication, this has been true with those patients that I'm familiar with, is that they just don't have much hunger cravings. They're like never really wanting to eat that much. In fact, one of my own personal family members, I won't say who that is, has been on this medication. And one of the things that was relayed to me is that basically the appetite was gone. And so this person was kind of happy because they lost a bunch of weight. But what I was really worried about is they weren't getting in adequate nutrition. And I'm going to give you 2 things I want you to really take home from this. If you're on this medication, if you're thinking about this medication, 2 things I would really consider to be super important so that you don't suffer from the severe side effects. And we're not talking about the thyroid cancer or the pancreatitis. Those should stand on their own as severe side effects. So if you have thyroid disease or if you've ever had pancreatitis, I would not be reaching for this medication. But if you are a type 2 diabetic, this may actually help you. And if you're trying to lose a bunch of weight and you're not a type 2 diabetic and you have an indication to do so, this may really help you, with the caveat that there can be some significant side effects. The first of which I'll share is when you lose a bunch of weight quickly, what happens is that you lose both fat and muscle. And what's reported with this particular medication is that the amount of muscle mass that you're losing is out of proportion to a typical weight loss. In other words, when somebody loses weight, typically 10, 15% of that weight will be muscle mass and the majority will be fat, water, and other things. And with Ozempic, there's been up to 30, 40, even 50% of the weight loss has been lean muscle mass, which is actually a really terrible thing, because if you want to have a great metabolism that is high functioning, that's going to get you not only feeling well, but to be healthy, you need to have muscle mass. Muscle mass is the #1 most important organ in your body with respect to your metabolism. And so if you're losing a bunch of muscle mass, which a lot of people have with this medication, it's a double whammy for a lot of reasons. One, later on, not only will your metabolism be slower, if you will, because you have less muscle, but you'll also be less mobile. You'll be more likely to have, it also is related to have an increased risk of osteopenia and osteoporosis and bone fractures and all these kinds of things as well, because you lose the protein, right? The structural integrity of our whole body. Collagen is the #1 protein in our body. It makes up most of our joints and bones and all these things. You're actually, most of the people that I've seen that take this medication are undernourished. They're not getting enough protein. They're not getting enough collagen. And so they're more likely to have these side effects, including the Ozempic face that you guys have heard about, right? How does that happen? Well, it happens because you lose a bunch of weight quickly. You lose a bunch of fat. You also lose muscle. And what happens is in the face, you just notice it more. You notice both muscle loss as well as the fat loss. And so your skin gets kind of saggy. You get wrinkles that you didn't notice before. And if you care at all about what you look like, I mean, it might really suck. This could be a really major thing. And so one of the ways to prevent this, if you have to be on this medication or if you're on it already, is to make sure you're getting adequate protein. And this means roughly almost all US adults could use about 100 grams a day. And that's just kind of a general statement. 0.7 to 1 gram per pound of lean body weight is what you should shoot for. I personally shoot for 150 grams. And if you're on Ozempic, I would try to shoot for at least 100 grams. And so although in general, you will decrease your calories because you're just not as hungry, I would not decrease your protein. Your protein needs to stay intact. It is so crucial, so critical. And the second thing that I would encourage not only people who may consider this medication, but just all of us in general, we should really be prioritizing protein in our diet. Protein should be the first thing you put on your plate. It's that important. The muscle of longevity, or I should say the secret of longevity, is the muscle mass, and protein is what makes that up. Because if you don't get enough, guess what your body does? It breaks down your very own muscle to use for the amino acids that it needs to stay alive. And so it's not a good thing to lose protein. And with Ozempic, they actually have a term for the protein loss associated with that. And so the first thing, make sure your protein intake is adequate. Usually about 100 grams will do for most folks. The second thing is you gotta do resistance training, some sort of weight, lifting, whether it be body weight, like I'm trying to, simulate an air squat as best as I can here with a broken ankle, and do body movement activities, whether it be a pull-up or a push-up or a lunge or a burpee or a plank or whatever it is to activate your muscles. This is so critical, not just with all humans, but if you're on this medication, Ozempic, you really want to preserve your muscle mass, or you're going to have way more likelihood to have significant side effects from this. So increase the protein, maintain your activity with resistance training. Those things are critical. And that's what I've seen has not been done. And most doctors don't even mention that because everybody's so excited. You'll lose 20 pounds, 30 pounds. My family member lost 30 pounds in a short time, but he was eating almost nothing and getting almost no nutrition. In fact, he told me the only two things he could even crave were like some kind of saltine crackers, I don't remember the variety, and then a Nacho Bel Grande at Taco Bell. And I'm like, that's the only nutrition you've had in 2 to 3 months? Like, that's ridiculous. I'm worried about you, So I would say if you want to consider these medications, they definitely could have benefit for you, potentially, especially if you're type 2 diabetic. What I don't like about these medications is there's no long-term data onto their safety and efficacy, because most folks, unless they continue them indefinitely, which I'm not sure is also a great idea because we don't have long-term studies on their safety, but those that have stopped this medication, almost all of them, like 80, 90% between 1 and 2 years, will regain all of the weight. And you can kind of, fill in the blanks why you think that might be the case. Primary one is they probably haven't changed their habits. And so what you guys are all doing here, you're here because you care about your health. You're here because you want to learn those habits. And so that's why it is so critical that we have proper nutrition, that we learn how to eat the proper way. And if Ozempic is a part of that, it could be helpful for some. I'm personally not prescribing it, but I'm certainly not poo-pooing anybody who does, as long as they give out the caveats that people should maintain protein intake at an optimal level, which is usually around 100 grams per day per individual. That's if you weigh about 100 pounds or more. And to make sure you're getting resistance training in. So that's all I wanted to say for tonight with respect to that, because I could go on for hours, but I did make a podcast. It's entitled Ozempic, Is It Safe? And that'll be available to you at the end of the night. And the podcast is called Unshakable Health. So I'm happy to stay on if there's any questions, but I didn't want to keep it too long.
Thank you so much, Thomas. Let's look in the chat really quick and see. I know that there's a question about, if you have type 2 diabetes, and you did answer that yes, this would be appropriate for somebody like that. You also gave some other parameters around it, but maybe anybody who has type 1 diabetes, and maybe those people know, but
Yeah,
can you
no
speak
for type
about
1,
that?
Definite no.
Yeah. Okay. Sounds good. And then somebody's mentioning a stomach paralysis after, like, as a side effect.
Yeah. I forgot to mention that. And so one of the reasons that people get satiated or feel full and they don't really want to eat much is because another one of the mechanisms by which Ozempic works, or semaglutide or the GLP-1 agonist, is that they delay gastric emptying. And so if you can think about your stomach, houses the food for a short term while it's getting the stomach acid and some digestive enzymes, and then it pushes it along to the small intestine and later the large intestine. In that process, when it's slowed down too much, especially in the stomach, that food just kind of sits there, kind of churns around, and it makes you, not want to eat anymore because the stomach is still full. So that's one of the mechanisms. It delays gastric emptying. But one of the things that has been shown is that some people will have this, you might have heard the term gastroparesis, which is really a terrible thing to have. I've literally seen folks come to the ER in agony and pain from this condition because their stomach contents never really move along appropriately. And one of the potential long-term effects from this medication is to have significant gastroparesis. And that's not a good thing, because not only does it alter your digestion, but it makes you feel like crap and you're throwing up and nauseous all the time. I mean, one of the most common side effects of this medication is nausea, a big surprise, right? Nausea. But if you get this condition, gastroparesis, not only will you be nauseous, but you could just be nonstop vomiting. And it's, yeah. So thanks for bringing that up, Phyllis.
You're welcome.
I have a quick question, if you don't mind. You talked about when these drugs are being prescribed. I had a client myself who came to me after he used the drug for a year. He ended up with a thyroid disorder that he never had before. But one of the things that he told me, that he was never counseled on anything nutrition wise from his physician. Do you find that that is common?
I would say, sadly, that's the norm. Most physicians are not well trained with respect to nutrition or diet or anything of that nature, food for that matter. I mean, even you go to a children's hospital where they're taking care of all kinds of children with medical problems, including cancers and things, and they're telling them to eat anything they want. It doesn't even matter, because it just matters that they get calories in their body, which is the worst advice you could ever give somebody, right? We know that food can be healing. It can be the best medication ever. Food is powerful, but it can also be a slow poison, and we get to pick. And if we're eating inflammatory foods, we can increase our risk of cancer. We can worsen the cancer that we already have. And so not giving any nutrition advice, I think, is really a sin. I mean, I understand that they don't, because most physicians have not had particular training in this, and they just don't have the time. So they should be recommending these patients all see a nutritionist who is familiar with this medication and familiar with good dietary practices, eating whole foods, timing the foods appropriately, avoiding, the inflammatory foods, that basically the ultra processed diet that sadly 60 to 70% of most Americans are eating, and kids, 70+% of their diet is ultra processed food. So to not give any nutrition counseling, I think it's just, sadly, it's very common, super, super common, but I think it's a sin, and it's got to be improved.
Thank you for that. You guys, this was amazing. Thank you, Dr. Thomas Hemingway. So he mentioned a lot about protein and about 100 grams to shoot for. If you are using the injection, that is still something you need to think about. But I also, because we are here as a Plexus group, a lot of us use Plexus. Maybe some of you are here, you don't know what Plexus is, or maybe you've never heard of gut health. But when you are shifting your food or lack thereof, you're also shifting your microbiome. And so when you're fueling your body, it is important also that you're choosing foods full of vitamins, minerals, prebiotics, and probiotics, because that supports your cells and, more importantly, your gut microbiome. So when you limit what you're eating or the lack of diversity, your gut microbes will start to shift, and we call this dysbiosis. Okay, that's an imbalance in gut bugs. Okay, did you know that our gut bugs, or our guts, are responsible for weight, like our metabolism, mood, so mental health, cravings for anything, guys, like shopping, porn, food, alcohol, like you name the addiction. It's crazy how our guts are responsible. It's a gut-brain connection. So energy, right? Immune system and sleep. So there's this 80-20. We want 80% good bugs, 20% bad. Sadly, in the United States, that tends to be shifted, and maybe most other countries as well, but for sure here. So when we have this imbalance, that's where we're getting this weight gain to begin with. Anxiety, depression, poor immune health, like maybe you're getting sick all the time, or you're just like, gosh, I'm always catching everything that comes along. Insomnia, fatigue, cravings for all the things we mentioned, but mostly sugar, carbs, alcohol. Why don't we address that with focusing on gut health? So that is the solution here, is the gut health. So good news, Plexus is the OG gut health company. They've been around since 2008, and you've got a lot of really amazing ambassadors here. So whoever invited you to this call, or if you saw them post, please reach out to them, because they can get you started. Because if you are using these shots, or maybe you're choosing not to, like, here is a great solution that will only help you. It is not a quick fix. You will not lose 30 pounds in 2 weeks or a month, but you will eventually lose weight. And so Just think of it as a supportive system that works alongside to restore the balance, remove the cravings, and set you up for success by giving you self-control, allowing you to make better decisions, whether it's with your food or movement. The cravings will disappear. Your metabolism increases naturally because now you're feeding the good gut bugs. Akkermansia, I call it the skinny bug. That's my own word for it because it does boost metabolism. But your energy will increase because now you are insulin sensitive. Your insulin drives that glucose into the cells for energy. And you would think that you had caffeine, but it's just your body's using glucose properly. So time and time again, people are reporting that when they start Plexus, they're saying this energy is there. So now I want to move my body. I feel like I need to move my body. So what happens if you're moving your body? You're building that muscle, that lean muscle mass that Dr. Hemingway talked about. So that just melts away fat. So when you are lifting weights, you're building muscle, you're burning fat. Mood disorders will disappear, allowing you to be more present with community, with your family, and really honestly, just happy in your own skin. Your sleep will become restorative, which is how our adrenals and other major organs reset and restore while our body is at rest. So we need a good 7 to 8 hours for our body to just chill and reset. So candida yeast is another thing. If you haven't heard of that, please Google it because that's another topic in itself, but it's being eliminated by our patented probiotics, which are responsible for cravings. Our gut and brain are connected. So when you slow or eliminate the growth of yeast, you're going to watch your cravings go away. And it's just through a probiotic, you guys. Healthy digestion is super important. When you're eliminating toxins, your body's able to release stored water that lives in fat cells. It's how our bodies protect us. And so we store those toxins and excess estrogens in our fat cells. With Plexus, the fat cells are destroyed and it releases these toxins into the system and those harmful amounts of estrogen, allowing the body to eliminate it through kidneys, liver, but mostly through stool, right? Through our digestive health. So I want to ask you guys a question. Did you know that pooping well means 1 to 3 times a day? And I did not know that. As a nurse, we were told, give them an enema after 3 days. If they haven't pooped in 3 days, give them an enema. So that was normal. So if any of this resonates with you, again, contact the person that invited you to this call. They're going to help tailor a specialized plan based on your health and wellness goals. Okay. We should all have health and wellness goals. So because there are numerous options for healthy weight management. So if you need to gain healthy weight, you need to lose some weight. This is beyond what we discussed today because we're right at the time. So thanks for hanging in there, but join us next week, same day, same time, same Zoom, as we take a deeper dive into how you can boost your metabolism, manage a healthy weight, and achieve long-lasting results. So I just want to give an extra special thanks to Misty, Dr. Hemingway, Carmen Broussard for collaborating to bring us such valued information. And we will see you next week, same time, same Zoom. Thanks so much for coming, guys.